So I'd like to now show a video done by Garcia. Vic is a pediatric surgeon at Cincinnati Children's Hospital. He's won numerous awards for his work on childhood disparities. He's won the Martin Luther King Humanitarian Award, and right at this moment, he is receiving the West Point Distinguished Graduate Award. 1 in 7,000 cadets gets this award, and he's getting the award for his work on childhood disparities. And so he badly wanted to be here, but he couldn't. So he created a video. It's a little over 10 minutes long, and we're going to show it now. I want to give one definition for you that he uses, and that is structural violence. And structural violence is where social institutions harm people by preventing them from meeting their basic needs. Okay, so can we show Dr. Garcia?
Saying that he who tells the best story wins. And it's my intention to tell you a compelling story of why dealing with health disparities, the social determinants of health, is not just a luxury, but it's actually a necessity, and that APSA can play a compelling role. Well, my story begins with, violence. And it's not just interpersonal violence as we're sort of familiar with it as gunshot wounds and stabbings. It's structural violence. And what I'm suggesting is that the structural violence that really drives the violence, the interpersonal violence that we see. It's structural violence that we now see is contributing to this death of despair among middle-class whites. It's structural violence that resulted during my tenure as the program director for trauma services with a 300% increase in the number of children coming to Cincinnati Children's Hospital with gunshot wounds. And this was an anomaly? No. This was the beginning of a trend. And even though the slides, the time frame here for this is 2006, we still have one of the highest homicide and violence rates. What was particularly unsettling for me was the mean age of 12.9 years. Children coming in some cases with multiple gunshot wounds, children coming in some cases with different admissions with gunshot wounds. This is not what I embarked on, what I envisioned when I went into pediatric surgery, but it is in my lane. It's in the scope of my responsibility as a pediatric surgeon. It was made an oath to bring about the health and well-being of children, all children. What particularly set me off on this page, on this journey, was a 14-year-old with the old gunshot wound to the chest. And despite my best efforts, and I was there, despite her being in what I felt was the best trauma program in the country, she died literally in my hands. And I went to that mother to try to sort of appease her, to comfort her, to console her. And I found myself saying the words, we did everything we could. But I also felt that was somewhat hypocritical, because I felt that I did not do everything that was possible. And I made a commitment to her that I would do everything that was necessary. And you see that changing in the framing of not just limiting myself to what was possible, but what was necessary, really put me on a whole different course. It took me out of the operating room into the annals of sociology, understanding systems thinking, looking at behavioral decision-making, and looking at a perfect storm in our inner city. When I sort of took the blinders off, I realized that the neighborhood, what Cincinnati Children's Hospital called home, was really the home to a constellation of unmitigated health disparities that jeopardized the health and well-being of all the children as well as their parents in that neighborhood. We had infant prematurity that was unparalleled in other parts of the state. We had infant deaths. Cincinnati has the highest infant mortality rate in the state. We had an epidemic of obesity with related cardiovascular disease among the adults that really prompted us to develop a weight loss surgery program. We had diabetes now being called not adult onset, but type 2 because of the epidemic among children. We had mass incarceration that affected the well-being for the life course of men and their families. And we had a new urban poverty that was unprecedented. And as a consequence of this spatial concentration of mass incarceration, we had men whose lifetime chances of really making a meaningful, purposeful living were compromised. Because you see, if you have been involved in the criminal justice system, your chances of getting meaningful, purposeful work are less than 5%. And in some cases, 1 out of 8 to 1 out of 9 African-American males between 18 and 34 are involved with the criminal justice system as a consequence of this phenomenon of mass incarceration. There was this phenomenon of redlining, so that we then have individuals segregated. They could not move out. And what's particularly unsettling about this is that there are studies that suggest that if you're able to move out of these neighborhoods, that you as an individual and as families can actually prosper. But that was not possible because of the structural violence that was imposed. There were policy, political, and economic decisions that helped contribute to this perfect storm. I became aware of the fact that really it's not about the individuals that are living in these neighborhoods, but that the problems in these inner city neighborhoods as a consequence, whether it's crime, family dissolution, social disorganization, et cetera, fundamentally is a consequence of the disappearance of work as a result of globalization and deindustrialization. Concerned about. The median wealth for an African-American male in this country as of 2012 was $4,900. There is no surprise that an individual with a family or without a family would look at alternative means, like the informal economy, drug system, to make a living. If you live in Cincinnati, the economists tell us that despite your best efforts, your chances of getting out, moving up the income ladder is about 5.1%. So working harder, obviously, is not working. Gary Becker helped to shed some light as to really what is the phenomena, what is the thinking then that results in some of the behaviors that we see. And individuals then pursue their own welfare as they conceive it, okay, based on looking at their environment, their ecosystem, and looking at the availability or lack thereof as far as opportunities in the economy leads them to behaviors that we otherwise would not condone. But this is no surprise. We see this at the corporate level. And here is an example of Philip Morris when faced with declining sales of cigarettes in the United States, decided to go to Czechoslovakia and suggested to them that it would be in their best interest to promote smoking in their community because of the premature deaths of their citizens would result in a net gain, financial net gain in savings. If a child in Cincinnati does not move out of that impoverished neighborhood where the perfect storm exists, they have a 70% chance that they're going to be there as an adult. And when you think about the fact that nationally 66, if not 70% of children are in impoverished neighborhoods, you can sort of begin to forecast then the consequences of that as far as their lifetime well-being, as well as economic achievement and educational accomplishments. This zip code, this phenomena, your zip code, matters more than any bacteria or virus. And that 20-year difference life expectancy is not seen in any other developed country. It is really a matter of humanity to man. It's a structural violence. And so far, it is unmitigated. And we can and must do something about it. But what really confirmed the path that I felt was the correct path was this story from one of the most successful drug dealers, Dante Ingram.
Even though I'm a street advocate now, I wasn't always a street advocate. I was actually one of them guys who was running around. Actually, I was one of the people that we're trying to help now. This city is bad with the violence, and we want to stop that. The message from law enforcement is not what turned me. It is not what's going to turn these guys. Saying, if you do wrong, we're going to lock you up. We know that. The threats is not going to turn these guys. It didn't turn me. That wasn't my motivation. My motivation was the community saying, look, if you want to get out of the life, we'll give you an opportunity, we'll help you, we'll give you a chance to do something else. These guys need opportunity. I was given an opportunity, and 2 years later, I've been working for 2 years. I've never worked a job for 2 months in my life ever. In 2 years, I've accomplished more than I ever did in the streets in 15 years. On June 28th of this year, I just closed on a house. I own a house now.
So what did I do about it? And what I would ask you to consider as one option is looking at it from an economic standpoint. How might we use market-based strategies to build community wealth in the urban core? Moving people out is certainly an option, but I don't think it's going to be scalable. But if we transform those neighborhoods where people live and make those preferred areas where people don't want to move out, but others want to move in, and if we did this in a way that we actually embraced equity, ecology, and economy, I believe that we can make a difference. So I started a nonprofit, and that nonprofit was an inspiration for a for-profit Waterfields. And that Waterfields is the growing microgreens hydroponically in inner city neighborhoods, intentionally hiring individuals from the inner city, going out and reaching them, very much like the Harlem Children's Zone has done, knocking on the doors and showing them that there are options and opportunities. We engaged some of the most unlikely partners, some of the people that you at one point in time would consider as part of the problem. And we found them to be willing partners in this work. And we did so with the mindset, the framing, that there are strengths, inherent strengths in these neighborhoods that are hidden. No more deaths of despair, as we're seeing here. No more 4-year-olds with major gunshot wounds. Though their physical scars are healed, that child's PTSD is something that we will have to deal with for the rest of his life. No more Chinas who, despite smiling in both pictures, life has been irreparably changed. And we have done this now for acute lymphocytic leukemia. We can accomplish the same dramatic improvements in these deaths of despair if we pay attention to this as a collective responsibility. Thank you. And I hope to see you at the workshop tomorrow.